The Role of Neurobiology in Social Work, Practice with Youth, Transitioning from Foster Care by Wendy B. Smith. Youth transitioning from foster care often confront significant challenges as they enter adulthood, primarily due to their experiences of abuse, neglect, and unstable family connections. This transition typically occurs abruptly at age 18 or upon high school graduation, leading many to lose the tenuous support networks they had while in care. In the United States, over 26,000 foster youth aged 17 to 20 emancipated from care in 2011. Additionally, the number of youth exiting care is notably higher, as more than 4,000 a year run away from placements. Despite legislative frameworks such as the Title IV-E Independent Living Program and the Foster Care Independence Act that focus on aiding this vulnerable population, many still struggle after leaving the foster care system. The developmental phase of emerging adulthood involves asserting independence and developing adult identities, with heightened uncertainties for foster youth. Statistics indicate that 18% to 36% experience homelessness post-emancipation, while up to 35% may move 5 or more times in quick succession. Education outcomes are similarly concerning, with as many as 50% not completing high school, only 20% to 30% attending college, and a mere 2% to 4% graduating. Furthermore, foster care alumni often have lower employment rates and earnings than their peers, with many living near or below the poverty line just 2 to 3 years after leaving care. The situation becomes even more alarming when considering that up to 50% of these youths report incarceration during the transitional period, a stark contrast to the 1% to 1.5% incarceration rate among non-foster youth. Mental health issues are prevalent, with studies showing that 42% of former foster youth report depression within the first year of leaving the system, compared to 27% of their peers. The issues disproportionately affect youth of color, who face systemic challenges that further complicate their transitions. However, many foster care alumni do manage to find stable housing, pursue education, and form relationships, underscoring the potential for resilience. It is essential to recognize that foster youth often endure neurobiological stress from a young age due to chronic abuse or neglect, frequently without the protective influence of caring adults. Trauma experienced in childhood significantly disrupts brain development, particularly affecting areas responsible for emotional regulation, decision-making, and stress response. The impact of such experiences can lead to alterations in the structure and function of the brain, as chronic stress activates the hypothalamic pituitary adrenal axis, resulting in elevated cortisol levels that can damage the hippocampus, a region critical for memory and learning. Additionally, the amygdala, which processes fear and emotional responses, may become hyperactive, heightening anxiety and impulsivity. While the prefrontal cortex, responsible for executive functions such as impulse control and reasoning, develops more slowly in response to this dysregulation. This imbalance manifests in behaviors often seen in youth transitioning from foster care, such as difficulty forming stable relationships, challenges in managing emotions, and heightened vulnerability to addiction or criminal behavior. The pressures they face can lead to dysregulated stress response systems, resulting in prolonged emotional difficulties as they form new relationships and navigate adult roles. Understanding adolescent brain development is vital for improving social work practices, as significant changes occur during this developmental stage. These changes include heightened sensitivity to rewards and increased stress reactivity. As the adolescent brain matures, the limbic system matures faster than the prefrontal cortex, leading to potentially reckless behavior due to a poor balance between emotional drives and cognitive control. Therefore, social work interventions should be informed by neurobiological insights, emphasizing the formation of supportive relationships to enhance resilience and emotional regulation. For example, The case study of Joseph illustrates how early traumas impacted his emotional and cognitive development, resulting in anxiety, impulsivity, and difficulties with relationships. Therapeutic interventions targeting both emotional healing and cognitive restructuring can help rewiring his responses and improve his functioning. Evidence-based treatment options like trauma-focused cognitive behavioral therapy can aid these youth in managing their psychological needs. Building trusting therapeutic relationships is crucial for fostering safe environments where youth can process their trauma and learn healthy coping mechanisms. Ethical and informed social work practices should address relational aspects of care, guiding youth to develop healthier attachment strategies and cope with their past experiences. Transitional living programs can serve as vital environments that further support youth in transitioning to adulthood by providing stability and fostering growth. These programs often lead to better mental health outcomes, educational achievements, and overall life satisfaction. Supporting effective caregiving and relational experiences is fundamental to developing resilience among young adults emerging from foster care. Moreover, recognizing the unique needs of LGBTQ youth who may face even more complex challenges is essential for creating nurturing environments. Engaging in interventions that consider the diverse backgrounds of youth, including factors such as ethnicity, culture, sexual orientation,